Hi, my name is Brandi. I am a licensed practical nurse for Dr. Michael Ryan at Missouri Vein Care. I have been a nurse since 2017 and began working with Dr. Ryan at his Cape Girardeau location. I now do all of the consultation intake for our patients, bringing you on board to our practice. You'll speak with me as we begin the first steps of getting to treatment. So with a vein condition, the veins begin to have something called venous reflux. There's a lot of pressure and backflow in the veins. There tends to be a weaker or leaky valve at times of the veins as well. And again, this causes the veins in the legs to not work properly. Some of the most common vein symptoms that we see are fatigue. A patient will report very low energy, low stamina, especially at the end of the day. If you ever feel like you just cannot keep going, you feel very tired out before your day is done, that is one of the number one symptoms that we see. Another symptom that's very common is just aching and pain of the legs in general. So again, towards the end of the day, your legs are very sore, they're achy, you don't feel like they should feel like this. We see cramps, Charlie horses, those muscle spasms that are very painful, particularly at night. We also see restless leg, heaviness and tiredness of the legs in our patients. In addition, we see swelling. Swelling can be a symptom that comes with vein conditions as well, among other symptoms. So the vein conditions that we treat come with a very specific pattern of how their symptoms onset. So what does that mean? That means we look for a specific pattern associated with your symptoms. A vein condition is always very present and prominent in the evening times or at night. We see that our patients are having more issues. They are complaining of worsened symptoms at the end of the day. You may, for instance, have swelling and you're unsure what that is related to. If this swelling is present all throughout the day, does not ever go away at night, continues to be the same and even increases, that is not as likely to be related to your veins. We see a pattern of swelling, for example, that may get worse or progress throughout the day. It's usually worse in the evening time after you've been on your feet, been on your legs all day. However, that swelling pattern will reduce and go away overnight when you're off your feet resting. That particular pattern matches what we see in our vein condition patients. So what does a vein screen look like? You will come into Missouri Vein Care, meet with some of our clinical staff, and we will begin to ask you about your symptoms, how and when they present themselves, and how much it is affecting your daily life. For example, you may be having aching, pain, and cramps of your legs. We're going to ask more questions to follow up to determine if the pattern of those symptoms match what we see in our vein condition patients. We will also take some measurements to fit you for stockings if it is needed for your particular scenario. We will take some pictures of your legs, a front and back picture, so that we can put those in your chart. And we will talk with you a little bit more about what you're experiencing, what your concern is, and how we think we might be able to help you, and if you're in the right spot for vein care with the symptoms you're experiencing in your legs. So once we see you in the office at Missouri Vein Care for your initial consultation appointment, Dr. Ryan will develop an individualized plan of care for how are we going to take care of the leg symptoms that you're experiencing. All of our treatments are done in the office. There's no surgeries, hospital stays, or anesthesia. You are allowed to be completely awake and comfortable during your procedures. You come into the office for the treatments, spend about 15 to 20 minutes with us for the treatment itself, and then you're able to walk right back out the door and resume your normal daily routine. Once we see you in your initial consultation, we will send off for a complete prior authorization with your insurance. So what does that mean? We basically submit a pre-approval to them for everything that Dr. Ryan would like to do before we get started with treatments. That way you know ahead of time exactly what your insurance will cover, if you may owe anything, and what you would be looking at as far as time goes with getting your treatments done. After you see us for your initial consultation, your insurance may require that you do a little bit of homework per se. Some insurances have a requirement that you try compression stockings before they will approve your treatments for your legs. This is very common. Usually the most common time frame that we see for compression stockings is a trial period of 6 weeks. So the patient will begin wearing compression stockings and then report back to us how those worked for you, if they worked, if they didn't. And then from that point on, you are able to move forwards towards your treatment process. We see patients daily that we have been able to help. If you have any questions or concerns or further questions regarding your symptoms and whether or not they might match a vein condition, please feel free to give us a call. We can do a free vein screening in the office to talk with you more about how we think we might be able to help you. We have helped so many patients improve their stamina, get back to what they used to love to do. We have helped so many patients with being able to be active again and not feel like they are bogged down by the issues with their legs.